Most cover letters don't get read, but mine did, and it got me a job in Australia. In this video, I will show you exactly how it is structured and how you can use the same approach to get your first job in Australia. A cover letter shows your intention. It tells the recruiters that you didn't just apply, you actually want this role. Second, it explains context that your resume cannot. Things like career changes, international experience, or why you're a good fit, even if you don't tick every box. And finally, it helps recruiters filter candidates. When hundreds of resumes look similar, a clear cover letter makes it easier for them to shortlist you. That's exactly how my cover letter helped me stand out. This cover letter is especially useful if you are applying for jobs in the hospitals, and it is designed for international medical graduates because we often need to explain our background more clearly than the local graduates. If you're applying for HMO, JMO, or RMO roles, this structure works really well. Even if you're applying for other healthcare roles, you can still adapt this format. Now, let's break down the exact sections of the cover letter. The first part of the cover letter is the header. This looks simple. It's important to keep it clean and professional. I included my name, primary qualification, current role, current hospital, my city and country, along with my email address and phone number and date. This makes it easy for recruiters to quickly see who you are and where you are applying from. And then you mention the complete hospital address. Then in the subject, you write about the role you are applying for, including the job reference number if it's given in the job advertisement. And I keep this bold and underlined. Now let's talk about whom to address in your cover letter. Ideally, you should address it to the clinical director. If you don't know their name, it's perfectly fine to write the clinical director or dear sir or madam. But if you do have a name from the job advertisement or the job description document, always use it. Now, let's move on to the main body of the cover letter, which is really the most important part. This section answers a few questions for the employer, like who you are, what you're currently doing, why you're applying, and whether you're eligible to work in Australia. First, briefly introduce yourself as a doctor, your qualification, level of training, and broad area of experience. This should be factual and concise, not a full CV summary. Next, mention what you're doing these days. This could be your current clinical role, any observership that you're doing or have done in the past, or any recent hospital experience, any workshops. Hospital employers want to know that you are actively engaged in medicine. Then explain why you want to apply for this role. Try to link your interest to the hospital, the department, or the Australian healthcare system rather than giving a generic answer. If you have passed AMC clinical, have working rights, or completed an observership, mention it clearly and confidently. The key point here is clarity. Recruiters should not have to guess whether you're eligible. You should make it obvious through your cover letter. In the next paragraph, you will connect your own experience to the role of an RMO or a HMO. Start by briefly stating that your previous clinical experience has prepared you for the responsibilities of an RMO or HMO. Focus on the skills like patient assessment, ward work, documentation, and working within the multidisciplinary team. If the job description asks for exposure in specific areas like surgery, emergency medicine, or gynae and obs, make sure you mention any relevant experience you have in those fields. Even short rotations or observerships are worth including if they are relevant. The goal here is to make it easy for the recruiter to see that you already function at the level that they're looking for, and you'll be safe and reliable from day one. In the next part of the cover letter, you mention your extra strengths. This could include involvement in research, clinical audits, participation in morbidity and mortality meetings, or delivering presentations. Highlighting these experiences shows your commitment to continuous learning, quality improvement, and teamwork. These qualities are highly valued by Australian employers. You don't go into detail here, just enough to catch their attention and encourage them to read your CV. The next section of the cover letter focuses on key skills. In Australia, recruiters are not only looking at your clinical knowledge, they place a lot of importance on how you work within the system. Start with communication skills. You can briefly mention your ability to communicate effectively with patients, seniors, nurses, and allied health staff. Flexibility is also important, especially for RMO and HMO roles. This includes adapting to different rotations, workloads, and on call requirements. Organization and time management skills are also essential for managing ward work, documentation, and also managing multiple patients safely simultaneously. You should also highlight your experience working in a multidisciplinary team, as MDT based care is a core part of Australian healthcare system. Finally, mention basic IT skills such as electronic medical records and ordering systems and clinical software use if the JD requires. Keep this section short and specific. One or two lines are enough to show that you already understand how the system works and you have the essential skills that is required and is expected of an RMO. Finally, keep the closing paragraph short and professional. Refer the employer to your CV for further details. Thank them for reviewing your application and sign off with your name. A clear and polite closing leaves a strong final impression. Here are some key tips to make sure your cover letter stands out. Keep it concise, to the point, one page ideally, maximum two. Maintain a clear and professional tone throughout. Customize it for each hospital you apply to. Do not share the same cover letter to every hospital. Include updated information about your skills, experiences, and achievements. Carefully read the job description and demonstrate how your skills match the requirements. Understand the hospital's vision and mission. You can go to the website of that hospital and read a little bit about it and explain how you can contribute to their goals. This is a format of my own cover letter, which I used for my job applications. So in the first section, I write full name, family qualification, my postgraduate year level, level 2, level 3, whatever your level is, the current hospital I am working in, and city, country, email address, and then write the date over here. Then I write the clinical director. There should be a comma here. And the hospital's full address, including the state, the postcode, whatever is given on the job advertisement. Just use that. Then this is the subject, application for HMO position, reference number, whatever reference number is given. Then dear hiring manager or dear clinical director or dear sir, madam would work as well. I am writing to express my interest in the HMO position at XYZ Hospital. I am a junior doctor currently practicing in XYZ country, eligible for limited registration with APRA. If you have passed IMG clinical, then you would be eligible for provisional registration with APRA. And I have successfully completed AMC exam. I have 2 years of clinical experience in a tertiary care setting, and I am working as a medical officer in XYZ. I have also completed an observership from ABC Hospital or Clinic, which provided valuable insight into the Australian healthcare system. I hold valid PTE score and I'm ALS certified by the Australian Resuscitation Council. I want to apply for this job to enhance my clinical skills, gain Australian experience, and apply for training positions in Australia. If you can write a better reason, a stronger reason, you can add that as well. And in the next part, I have written, I am well suited for this role as I have hands-on experience in duties consistent with this position. I have completed my internship rotations across emergency medicine, medical and surgical specialties. I am confident in history taking, physical examination, ordering and interpreting investigation, and initiating patient management under supervision. In most of the job description, this is the responsibilities that is given and is expected of an RMO. And more or less every job description is the same. My responsibilities include conducting ward rounds, maintaining accurate clinical documentation, preparing discharge summaries, referrals, coordinating follow-up care, and managing admitted patients in collaboration with the medical staff and multidisciplinary teams. So this section highlights your skills, and it should resonate with the job description. In addition, I have been involved in clinical audit and research activities, including, then you'll mention your work here, and regularly participate in case presentations and morbidity and mortality meetings to support continuous improvement in patient care. I possess strong IT skills and I am comfortable using EMR system with the ability to adapt quickly to new digital platforms. You can mention this if the job advertisement or job description requires IT skills. I have developed effective communication and interpersonal skills through regular interaction with patients, their families, and other healthcare team members. I demonstrate a patient centered approach, strong organization skills, flexibility, and ability to prioritize workload in a busy. And in your CV, you will briefly explain how you possess organization skills, how you possess flexibility. Just briefly explain it in the CV so the recruiter gets an idea. And in the end, further details of my qualifications and experience are outlined in my CV. I would welcome the opportunity to discuss my application and suitability for this position at your convenience. Thank you for considering my application. Sincerely, then your name. So this paragraph can change, and it depends on what the recruiter is now looking for. Just read the job description and add whatever they're asking for, and in your CV briefly explain about those skills